Night shift nurse Patricia Williams was returning home from an Arizona desert hospital when she experienced a roadside breakdown and, while waiting for help, noticed a crashed UFO in a nearby ravine. During her investigation, she encountered 3 different alien species, each species showing completely different physiology, behavior patterns, and apparent hierarchy structure. Welcome to Shelley's Mystery Files. Today I'm going to share with you a story about an extraordinary encounter where a nurse in Arizona desert met 3 different alien species at the same time. Patricia, could you first introduce yourself and tell us about your nursing background in Arizona?
Hello, Shelley. I'm Patricia Williams, 56 years old, and I worked in Arizona hospitals for 18 years, mainly in emergency departments and intensive care units. I worked as night shift supervisor at Desert Regional Medical Center, specializing in trauma response and critical patient care. In rural Arizona healthcare, isolated emergency situations are familiar territory.
What were the specifics of your night shift on August 14, 1994, and what was your normal duties coverage?
Standard 12-hour night shift, 1900 to 700, emergency department supervisor duties, trauma cases, critical care coordination. It was a busy night with multiple vehicle accidents and heat exhaustion cases, typical Arizona summer emergency volume. The shift was completed normally with standard end-of-shift procedures.
What kind of geographic environment was the hospital location and surrounding desert area characteristics?
The hospital was located in central Arizona desert region, surrounded by mountainous terrain, deep ravines, and isolated highway corridors. Minimal light pollution, excellent night sky visibility, rugged landscape with scattered vegetation. The nearest major city was 80 miles away.
What was your normal route home and vehicle specifications after shift departure?
Standard route via State Highway 89, approximately a 45-minute drive to my residence. I was driving a 1992 Honda Accord, a well-maintained vehicle with reliable transportation. It was a familiar route I'd driven hundreds of times with predictable road conditions.
When did the vehicle breakdown occur, and what were the initial symptoms?
At approximately 7:30, near mile marker 67, the engine started overheating and the temperature gauge was climbing rapidly. I pulled over roadside with the hood steaming and a coolant leak apparent. It was a standard automotive problem, but the isolated location was concerning.
What were the roadside assistance options and communication availability in the isolated area?
Cell phone coverage was minimal in the area with occasional signal, but unreliable. I decided to wait for passing traffic and flag down assistance. It was early morning with very light traffic on the desert highway, so I prepared for an extended wait.
When did you first notice the crashed UFO, and what was your initial observation?
While waiting for assistance at approximately 8:15, I noticed an unusual metallic reflection in a ravine about a quarter mile from the road. Initially, I thought it was aircraft wreckage, possibly a small plane crash requiring medical assistance. My professional nursing instinct was activated.
How did you make the decision to approach the ravine, and what were your safety considerations?
Medical professional obligation to assist potential crash victims. I grabbed a first aid kit from the car and approached carefully across desert terrain. The steep ravine required cautious descent, but emergency medical training emphasized rapid response.
How did object recognition occur at closer proximity, and what was the realization moment?
At approximately 100 yards, I realized it definitely wasn't conventional aircraft. It was a large disc-shaped object, estimated 60 feet in diameter, with a metallic surface and no visible wings or propulsion systems. The technology was clearly beyond human capability.
When did you first notice an alien being, and how did you identify the species?
Near the craft, I saw a tall figure moving systematically around the perimeter, approximately 8 feet in height, with a very thin build and elongated limbs. The skin appeared translucent white with a large head, and movements were fluid and purposeful. First species, definitely non-human.
What were the second alien species characteristics, and what were the physical differences?
The second being was much shorter, approximately 4 feet, with a stocky build and gray-colored skin with rougher texture. Large, dark eyes, minimal facial features, broader proportions. Completely different physiology from the first species. Clear species distinction.
What were your third species observations, and could you make a comparative analysis?
The third being was intermediate size, approximately 6 feet, with golden-tinted skin and more human-like proportions, but clearly alien features. It seemed to coordinate activities between the other two species with an apparent leadership or supervisory role.
What were the species interaction patterns you observed, and what was the hierarchy structure?
Clear communication between species, though no audible speech was detected. The golden-skinned being appeared to direct activities. The tall white being performed technical tasks, and the shorter gray being handled materials. It was a coordinated team operation.
What was your approach strategy, and what was your professional assessment mentality?
I maintained medical professional composure and approached as a potential emergency situation requiring assistance. Nursing training emphasized remaining calm during unusual circumstances and providing aid regardless of circumstances.
When did the being's awareness of your presence become apparent?
At approximately 50 feet, all three beings simultaneously turned toward my position. Clear recognition of human presence, but no aggressive response. They seemed surprised but not threatened by my approach.
Did you attempt direct communication, and what was your initial contact protocol?
I called out standard medical identification. "I'm a nurse. Do you need medical assistance?" No verbal response, but clear understanding was demonstrated through body language. The golden being gestured for me to approach.
Did you have a closer examination opportunity? And what were your detailed observations?
I approached within 20 feet and could observe detailed physical characteristics, technology, and apparent injury assessment. The craft showed damage consistent with the crash landing, and the beings were conducting repair operations.
Did you make a medical assessment of the being's condition?
Professional medical evaluation indicated no obvious injuries, but the beings appeared fatigued and stressed. The golden being gestured toward the craft interior, seeming to request medical consultation about the situation.
How did you respond to the invitation to the craft interior, and what was your safety assessment?
Nursing instinct emphasized providing aid when requested. No immediate threat was detected, and the beings appeared to need assistance. I decided to offer medical consultation based on professional obligations.
Can you describe the interior environment and your technology observations?
Smooth, seamless interior surfaces with soft lighting and no visible control panels or familiar technology. Advanced medical-looking equipment, scanning devices, and materials beyond human medical science. Very clean, sterile environment.
What were the characteristics of the medical equipment, and were there any familiar elements?
Some equipment resembled advanced medical scanners and diagnostic tools, but the technology was far beyond hospital equipment. The instruments seemed designed for multiple species physiology with adaptable configurations.
How did the beings demonstrate their medical knowledge?
The golden being used a handheld device to scan my body and displayed detailed internal imaging superior to hospital X-ray or MRI technology. They clearly had advanced medical diagnostic capability far exceeding human medicine.
Did you engage in medical knowledge exchange and information sharing?
Through gestures and device demonstrations, I shared basic human anatomy knowledge and emergency medical procedures. The beings showed intense interest in human medical techniques, particularly trauma treatment.
Did you observe species-specific medical differences and physiological variations?
Each species required different medical approaches. The tall white being had a complex circulatory system. The gray being showed enhanced respiratory capacity, and the golden being appeared most human-like, but with advanced neural development.
Did communication enhancement occur over time, and was there understanding improvement?
We gradually developed a nonverbal communication system through medical demonstrations and anatomical comparisons. Universal medical concepts transcended species barriers and created mutual understanding.
Did you participate in diagnostic procedures and collaborative medicine?
I assisted with medical scanning procedures, demonstrated human first aid techniques, and shared emergency medical protocols. The beings were very interested in human healing methods and pain management.
What were the technology demonstrations like, and what advanced medical capabilities did you see?
I witnessed tissue regeneration technology, instant diagnostic scanning, and advanced surgical techniques. Medical capabilities were centuries beyond human development, but they were interested in human practical experience.
What was the duration of the encounter, and what was the activity timeline?
Total encounter was approximately 3 hours. Extended medical consultation, knowledge sharing, and demonstration of various medical techniques, both human and alien. The most comprehensive medical exchange possible.
How was departure preparation indicated, and what were the conclusion signals?
The golden being gestured appreciation for medical assistance and indicated repair operations were completed. Clear indication the encounter was concluding, but positive interaction throughout.
Were there parting gifts or medical knowledge transfer?
The golden being provided a small diagnostic device and demonstrated basic operation for human medical use. It was an advanced healing accelerator, far beyond human medical technology.
How did you witness the craft departure, and what were your final observations?
The beings boarded the craft systematically with a smooth takeoff without sound or disturbance. Rapid acceleration, disappeared into the morning sky within seconds. Complete reversal of the crash landing.
How did the return to your vehicle proceed, and what was the reality adjustment like?
I walked back to the highway in a state of amazement and found a passing motorist had stopped to assist with the breakdown. A tow truck arrived shortly after. Normal automotive repair situation.
Did you test the diagnostic device functionality and practical application?
The device appeared to enhance diagnostic accuracy when treating patients and accelerated healing in minor injuries. I used it sparingly to avoid detection, but it significantly improved patient outcomes.
What were your disclosure attempts to hospital colleagues, and what was the professional community response?
Gradual, careful disclosure to trusted medical colleagues. Mixed reactions. Some were interested in the diagnostic device capabilities, others were skeptical about encounter claims. The medical community is generally evidence-based.
Was there medical research interest in the advanced technology and scientific investigation?
Informal medical research collaboration with progressive physicians interested in advanced diagnostic techniques. Device analysis revealed technology far beyond current medical science understanding.
What was the patient care improvement impact after the encounter?
Enhanced diagnostic abilities, improved patient assessment skills, and better understanding of multi-system medical approaches. My nursing capabilities were significantly enhanced through alien medical knowledge.
Did you research similar desert encounters and pattern recognition?
I extensively researched Arizona UFO databases after my encounter and found dozens of similar desert encounters spanning decades. Many reports specifically mentioned medical professionals being approached or contacted by extraterrestrial beings. Pattern analysis revealed Arizona desert corridors were particularly active for UFO encounters, involving healthcare workers, nurses, doctors, paramedics, and medical technicians. Geographic clustering around hospital routes, medical facilities, and emergency response corridors suggested deliberate targeting of medical professionals. I found reports dating back to the 1960s documenting similar three-species encounters in desert regions. The pattern indicated an ongoing extraterrestrial medical research program using isolated areas for safe contact with human healthcare professionals. Multiple witnesses described similar diagnostic technology, medical knowledge exchange, and cooperative alien species working together on apparent medical missions.
How did you interpret the significance of interspecies cooperation from a medical perspective?
Medical collaboration between three distinct alien species represented the most advanced healthcare model ever witnessed. An intergalactic healthcare system indicating shared medical knowledge databases and a cooperative approach to healing, transcending species barriers completely. Each species contributed unique medical expertise. Tall white beings specialized in advanced diagnostics, gray beings focused on physiological systems analysis, and golden beings provided coordination and surgical techniques. The collaboration suggested medical knowledge pooling across different evolutionary paths, different planetary environments, and different biological systems. Universal medical principles apparently exist beyond species limitations, with healing instincts common across intelligent life forms. Interspecies medical cooperation indicated peaceful intentions, scientific advancement priorities, and shared commitment to reducing suffering regardless of species origin. The most significant aspect, medical knowledge was considered a universal benefit, not a competitive advantage between alien civilizations.
What was the career development impact and professional advancement post-encounter?
Enhanced reputation for diagnostic accuracy, promoted to senior nursing positions, and developed innovative patient care protocols. My medical expertise was significantly improved through extraterrestrial knowledge integration.
What was the diagnostic device's long-term functionality, and what were the maintenance requirements?
The device continued functioning for several years, but gradually lost effectiveness over time. No maintenance instructions were provided, and it eventually stopped working completely. It was remarkable technology while operational.
What was the family disclosure and personal relationships impact post-encounter?
My family was supportive, but concerned about professional implications. The medical encounter was more credible than typical UFO stories due to practical medical technology demonstration.
Were there medical ethics considerations in using alien technology?
careful ethical consideration about using advanced technology without full understanding. I used it primarily for diagnostic enhancement, never for procedures beyond human medical capability.
Does the encounter influence continue in your current medical practice?
I retired from active nursing, but continue consulting on unusual medical cases. Enhanced diagnostic intuition and multi-system medical understanding continue benefiting patient care.
What are your future contact expectations and preparedness planning?
I'm open to potential repeat contact, particularly medical consultation scenarios, better prepared for documentation, medical knowledge exchange, and interspecies healthcare collaboration.
Finally, what is your advice to medical professionals for similar encounters?
Maintain professional medical objectivity, apply healing instincts regardless of circumstances, and document everything. Medical professionals are uniquely qualified for extraterrestrial medical consultation.
Patricia, thank you for sharing this incredible three-species medical encounter with us. The medical professional perspective is very valuable.
Thank you, Shelley. I hope my account encourages medical professionals to report unusual encounters. Healthcare transcends species barriers.
Patricia Williams' experience in the Arizona desert shows that 3 different alien species actively collaborate to share medical knowledge and are interested in establishing constructive interaction with human healthcare professionals. The detailed observations from a medical professional with 18 years of nursing experience reveal the advancement level of extraterrestrial medicine and the possibility of interspecies healthcare cooperation. If you've experienced similar unusual encounters in the medical field, please share with us in the comments. Don't forget to subscribe to Shelley's Mystery Files channel and see you in our next medical mystery.